There are a lot of misconceptions about spine surgeons and spine surgery that I think are important to address. First and foremost, we have a lot of patients that are hesitant to come see us in the office because they think that we will recommend surgery. In fact, 80 to 90% of patients that we see in the office are successfully treated without surgery. When I tell my patients that there's a very good chance that we will be able to successfully treat their condition without surgery, I think it provides them with a lot of comfort and relief. A lot of patients think that spine surgery is often unsuccessful, whereas in fact appropriately indicated spine surgery, particularly for leg and arm pain with associated numbness and weakness, is one of the most successful operations that we have. Not all patients need a spinal fusion, and by doing a decompression or even a disc replacement, we're able to maintain motion for the patients and avoid a fusion procedure. Of course, in some instances, a fusion is actually indicated and the most appropriate procedure, but we only utilize it when it's absolutely necessary. As spine surgeons, we take care of patients of all ages. We always try to avoid surgery if at all possible, but in some instances, even for younger patients, we do recommend a surgical procedure. This is often to remove pressure off the nerve or even their spinal cord. I think everybody's situation is unique, and that's why it's important to consider all factors that are specific to each patient, their goals, and their family.